Assalamu alaikum everyone. This is Raheen. So today we will be having a one-shot lecture on the foundation module anatomy, mainly the gross anatomy. We will be discussing in the one-shot lecture. I hope everyone will be tuning here, will be watching till the end. So let's start with the first chapter where we have the introduction to the general anatomy mainly. So let's start. So now, what does the term anatomy means? Whenever we talk about the term anatomy, we need to remember it is mainly meaning to cutting up. It is derived from the Greek word which is the anatom, means anatomy just means cutting up. Now, next when we move further, the anatomy was mainly studied by the dissection mainly. So now there are mainly further two divisions in for the anatomy. When we talk about it, we have the cadaveric anatomy and we have also the other one, the let me show it with you, the living anatomy, obviously. So first we talk about the cadaveric anatomy. The cadaver, the word cadaver means the person who is dead or mainly the dead body. The cadaveric anatomy is normally used to study the dissections on the dead person or dead body, where we will be discussing different parts like the GIT organs and nervous system, etc. We will be dividing the anatomy history of the cadaveric system into the two main parts, the regional anatomy and the systemic anatomy. Now, what does the regional means? Now, the regional means it is specifically related to the particular region. And when we talk about the thorax, the upper limb, the brain, these are the regional anatomy. But when we talk about the systemic anatomy, it will be mainly including the respiratory system, which consists of the nose, nasal cavity, trachea, bronchus, all the way to the lungs mainly. So this is our two major divisions, the regional and the systemic anatomies mainly. Now, when we talk about systemic anatomy, we will be studying the lots of term. The osteology means the study of the skeletal system. The muscular system will be known as myology. Articular system known as the arthrology, and the vascular system obviously means the angiology. Respiratory, digestive, and the urogenital systems, which are mainly enclosed in the cavity, which is called as the splanchnic cavity. That's why they are known as the splanchnology as well. Now, when we move to another type of the anatomy, which is the living anatomy. Now, the living anatomy is normally performed or studied or mainly observed on the living person, and it involves some of the methods which include the inspection, palpitation. What is the palpitation? Palpitation is going to be mainly using the hands to palpate specific organs. Then we have the percussion, the tapping of the specific areas of our body to hear the sound. We have the auscultation, the endoscopy, the radiography, the electromyography. These are the living anatomy. These will be studied on the living organism to obtain fruitful results mainly. Now we have the embryology. What is the embryology? Embryology is going to be the developmental anatomy, that how the structures develop. Then we have the histology, which is the microscopic anatomy, which we commonly study here during the biopsies. Then we have the surface anatomy, which is mainly usually the anatomy we study based on the surface features of the body mainly. Okay, so let's move on. We have the question number six, which says radiographic or imaging anatomy, which will be mainly studied by the ultrasound, CT scans, X-rays. These will be the radiographic anatomy. This will be consisting of the contrast images to identify any abnormality or pathology present. Now, when we move on, we have the further divisions of the anatomy, which are, for the exam point of view, are less important, but we will see it. Comparative anatomy, which is going to be mainly involving the comparison of the various structure. Then we have the physical anthropology. Physical anthropology means how the different races of the people are related with each other and how they are mainly related to the people in the past. Like one of the most common perception of the life we have is the life begin of the human from the apes mainly. So we will be testing it in physical anthropology, where we will be manipulating the DNAs mainly. Now, when we talk about question number 9, it's sorry, part 9. I'm so used to the questions. Okay, so we have the applied anatomy. Now, what is the applied anatomy? The applied anatomy is mainly the clinical anatomy. Now, when we study something, it is mainly for the structures we know. But when we apply it clinically for the medical or the surgical practices, we classify it as the applied or clinical anatomy. Then we have the experimental anatomy, which is the study of the factors which we will be having to discuss, which will be involved in the forming or structure of functions on the different parts of the body, like what is the function of the biceps, the triceps. Then we have the genetics, which will be mainly dealing with the study under the chromosomes mainly. Okay, guys, this was all about the basic anatomy, where we classified it as the term. Now moving to the next part, we have the positions mainly. Now when we talk about the position, we need to remember that there are the 3 to 4 main important positions. The first is the anatomical position. Here you guys can see this is our person in the anatomical position. What will be involved in the anatomical position? The person will be standing erect with the head or neck erect, looking forward with the hands lying side by side with the palm facing anteriorly. The feet are placed close together. There you can mainly appreciate it from here. Next, we have the supine position. Now let me show you. This is our supine position. The person will be resting on his back and the thighs and the buttocks mainly, and here the palms will be facing superiorly, the head will be facing also superiorly, and the thorax and the anterior aspect of the thigh will be present superiorly, with the arms are also dangling on either side of this, will be also facing superiorly. Now when we talk about the prone position, the person will be lying on his chest or its pelvis mainly, and the neck or head will be mainly facing the the person will be also lying on his thorax and also the neck and the head as well, with the palm will be facing superiorly mainly. Now we have another common position, the lithotomy position, which we normally use for the vaginal birth systems. So now lithotomy position involves the person being lying in the supine position, but instead of the feet being put together with the body, as we see it right here, the lithotomy involved the feet being supported by some straps or mainly some apparatus just to hold the feet high up. This is mainly to open the pelvis mainly. Now, when we talk about the planes, we need to remember the three important planes. We have the coronal, median, and the transverse plane. The transverse plane will be dividing the body. Here you guys can see this is our transverse plane. This will be dividing the body into the horizontally into the superior part and the inferior part. These are the transverse plane. But when we talk about the coronal plane, we will be having the posterior divisions and the anterior division. But when we talk about the median plane, it will be the left and the right divisions mainly. Okay. One thing we need to remember, the median plane is also known as a mid-sagittal plane mainly. Now, mid-sagittal plane will be also the name we will be using for the median plane occasionally. Now, another plane we will be discussing is the sagittal plane mainly. Now, what is the sagittal plane? Like the median or the mid-sagittal plane, it will be dividing the body into the two parts, the right and the left parts, but it would not be equal to each other. Let us suppose if I divide it right here, this will be our right side and this will be our left side, but the left side and the right side is not equal to each other, and therefore this plane is known as the sagittal plane mainly. Now we will be discussing some of the basic terms which will be related to the trunk. Now when we talk about the ventral or the anterior aspect, it normally means the front of the trunk. Now this is our ventral or the anterior aspect. Dorsal or posterior means the back. Medial will be mainly the structure present close to the median plane or the midline, whereas lateral will be present away from the median plane or midline. Then we have the proximal, which will be also known as the cranial or the superior, which will be present closer to the structure we will be discussing. Like for here, we have the trunk, so proximal will be closer to the trunk here. Then we have the distal, caudal, or the inferior, which will be present at the lower end or away from the connecting part of the trunk. Then we have the superficial, which is present close to the skin. Then we have the deep, which is present away or deeper to the skin. Then we have the ipsilateral on the same side of the body. If I say I have the pain in the right leg, then I will say also the ipsilateral pain on the right arm as well. Then we have the contralateral, which is the opposite side of the body. Then we have the invagination, which is the projection moving inside. Evagination, which is the projection moving outside. Here we have seen. Now we move to the relations, which we will be talking about the limbs. We have discussed what is the ventral anterior. Now when we talk about the medial border, we need to remember which will be located close to the midline. For the upper limb, this will be going to be from the medial border of the forearm along the little finger and the arm, but for the lower limb, it will be mainly from the big toe or the helix to the medial border of the leg and then the medial border of the thigh. Then we talk about the palmar aspect, which is the front of the palm. Then we have the dorsal, which is back of the palm. Then we have the flexor aspect, which is mainly in the front of the upper limb. While when we talk about the lower limb, the flexor will be present on the back of the lower limb mainly. Now, when we talk about the extensor will be present at the back of the upper limb and anterior to the lower limb. Okay. Next, move on. We have some of the common terms. We have the ventral, which is present anteriorly, dorsal present posteriorly. Cranial means the top part or the part which is located close to the head, which is also called as cranial. Rostral, another term, we normally use it as the cephalic as well. Okay, then we have the caudal, which is present towards the legs or towards the tail mainly. Now, when we talk about the movements, we need to remember we have the gliding movements, which involve the back and forth movements, like the wrist. When we glide the wrist, we have the gliding movement, the angular movements which are produced at the specific angles, like for the elbow, when the two bones, the forearm and the arm bones are brought close to each other, these are called as flexion. When the angle is increased, it is known as the extension. Now, what is the lateral flexion? Lateral flexion is the movement of the trunk, or mainly used for the trunk on either side of the midline mainly. Let's see if I can find a diagram for you guys. Let's see if we can find it further. Now, for it, we move for the next term. We have the rotation. Now, what is the rotation? We have the two types of the rotation. We have the medial rotation and the lateral rotation. Remember, whenever the medial rotation is being described, this means the anterior surface of the limb is brought closer towards the midline. But when the lateral rotation is being asked, we need to remember it will be moved away from the midline. Next, we have the special movements which are on the specific joints, like the pronation and supination, which is specific to the radio ulnar joint, which is the joint of the forearm. Supination, pronation, these are the radial ulnar joint specific. Protraction and retraction, which are specific to the TMJ, which is the temporomandibular joint mainly. Now, when we talk about the flexion, what is the flexion? Flexion means the two flexor surfaces are brought close to each other and the angle between them are decreased mainly. Then we talk about the extension. Extension means increasing the angle between the two structures. Then we have the abduction. Abduction is mainly defined when the limb is taken away from the body or away from the midline mainly. Here you guys can see this is our abduction, which the limb is taken away. When it will be brought back towards the midline, it will be known as the adduction mainly, or adduction. Now, what is the circumduction? Circumduction is going to be mainly the combination of the extension, abduction, flexion, and the adduction mainly, producing a circular movement. Then we have to discuss what is the medial and the lateral rotations. Then the supination. The supination is going to be the movement or the position where the palm is facing forwards or anteriorly, whereas pronation is the movement where the palm is facing posteriorly. Now, the adduction means the finger or anything being brought close with each other. Then the abduction, we have already discussed, abduction movement is away from each other. When we talk about the opposition of the thumb, it is going to be a movement in which the thumb is opposed or brought close together the tip or the finger pad of the other fingers. Then we have the circumduction of the thumb, which is the circumduction of the limb, involving the four main the types of the movement: the extension, the abduction, the flexion, and the adduction mainly. Now, when we talk about the lower limb, all the terms will be kind of similar except the flexion and extension. The flexion will be, when we talk about the flexion of the knee and the flexion of the thigh, we have the two different terms. The thigh will be always flexed when the front of the thigh comes in contact with the abdomen, whereas the knee will be flexed when the lower leg or the heel will be coming in contact with the thigh mainly. Then we have the extension of the knee, which will be opposite to the flexion, which will be mainly straightening and increasing the angle with the abdomen. Then we have the dorsiflexion of the foot, which means the opposite region to the sole of the foot, which we called it as the dorsum, is moved closer to the leg. This is the dorsiflexion mainly. Let me show you a diagram. Here you guys can see the dorsum of the foot is being brought close to the leg. This is the dorsiflexion. But when this front or the dorsum of the foot is moved away, this is known as the plantar flexion, because now we have the sole been moving downwards with the dorsum as well. With the heel being dragged upwards, for the dorsiflexion, the heel will be dragged downwards mainly. Now we have the inversion and eversion. So now this is the inversion when when the part of the foot is going to be brought close to the midline is inversion, and here this is our inversion, and then when it moves away from the midline is eversion mainly. Then we talk about specifically to the neck, we have the flexion, extension, which is similar. We also have the lateral flexion, which is when the ear comes to rest on the shoulder mainly. Then we have the rotation when the chin is being brought close to the shoulder on the opposite side. Then we have the opening and the closure of the mouth, which is produced at the temporomandibular joint. And the protraction and retraction is the movement. Protraction means the lower jaw is being brought forward on the upper jaw, while the retraction means the lower jaw slides backward in its socket, so it restores its normal position mainly. Now, when we talk about the trunk, we have the same basic movements. The forward bending, this movement is flexion. The backward bending is extension. The sideways movement is lateral flexion, which we have discussed previously. And then when we rotate on either side, we have the lateral rotation. Now, when we talk about the specific muscles terms, we have the origin, the insertion. The origin is going to be mainly the point or part of the bone where it will be mainly originating from. Now, for the in any muscle, the origin can be from the bone or is the bone mainly, and this is part of the muscle which usually do not move during the movement. Insertion is the part of the muscle which attaches distally, and this part will be moving with the muscle contractions mainly. Now, when we talk about the belly is going to be mainly the major chunk or the fleshy part of the muscle which contains the contractile unit. When we talk about the tendons are going to be the fibrous, distal or the proximal and cord-like structures present on either side of the muscles, which are mainly responsible for the attachment of the muscles. Then when we talk about the aponeurosis, now what is aponeurosis? The aponeurosis, just like the tendon, is the flattened tendon, means it is also the tendon, but instead of being cord-like, it is spread out like this sheet mainly. Next, we have the term raphe. The raphe is going to be mainly a fibrous band which is present between the two interlacing or interdigiting fibers of the muscles mainly. For example, when we talk about for the mouth, we have the mylohyoid muscle for the mouth, which will be having the raphe mainly. Let me share a diagram with you, so it will be helpful for you guys to visualize it. Here you guys can see this is from the grace. This is our raphe. This is our raphe. You guys can appreciate it. The mylohyoid muscles with the midline raphe. Now, unlike the tendon, it is quite flexible mainly, and it is stretchable as well. Now, for the vessels, we need know what are the basic terms: the arteries, the veins, and the capillaries. The artery carrying the oxygenated blood, always carrying the oxygenated blood, except for the two major arteries, the pulmonary and the umbilical arteries. Then we have the veins, which will be carrying the deoxygenated blood, except the two main veins, the pulmonary and the umbilical veins mainly. Then we talk about the capillaries, which are the network of the microscopic vessels connecting the arteries and the veins, with the smaller division also called as arterioles and venules mainly. When we talk about the anastomosis is going to be mainly the communication between the vessels mainly. Now, when we talk about the terms which we normally use to describe for the bone, we have the elevation, which is three types mainly. A linear elevation is mainly described as the lip, ridge, or line or crest mainly, whereas the sharp elevation, just like this or mainly like this will be known as the spine, the styloid process, the cornu or the horn, the hamulus mainly. The rounded elevation, which is just like this, which will be mainly described as the tuberosity, tubercle, epicondyle, malleus, or the trochanter mainly. Then we have the depression. Depression is mainly a pit or mainly the fossa or groove or notch or impression. These are mainly the term used to describe for the depression. Then we talk about the openings. We have multiple terms for the opening. We have the foramen, the canal, the hiatus, the aqueduct. These are mainly the terms we use for the opening mainly. Here you guys can see different terms used here. Then we have the cavities. Now, what is the cavities? Cavity is going to be in a large space present somewhere in the body is referred as the cavity mainly. Now, the smooth articular areas of the bones may be covered by the articular cartilage, and this may include the condyles, the head, the capticulum, the trochleas mainly. Now, the basic terms we will be using for the clinical anatomy, which are as follow. We will be discussing remember guys, whenever the term itis occurs in the suffix, it means only inflammation. The appendicitis, the tonsillitis, the arthritis, the dermatitis, this all means inflammation. The suffix actomy means the removal of the some organ like appendectomy, the tonsillectomy, the gastrectomy, the hysterectomy. This mainly means the removal. of the specific organs. The appendectomy means the removal of the organ, the tonsillectomy, removal of the tonsils, gastrectomy, removal of the part of the stomach, as well as the nephrectomy or the hysterectomy means the removal of the kidney and uterus respectively. Now when we talk about otomy, otomy means to open a structure and then to close it out mainly, whereas the ostomy is normally used to describe a opening of the structure and leaving it open. Next term we have the omas, which is the used to describe the tumors, which is lipoma, the osteoma, the sarcomas, the hemangiomas, carcinomas, normally used to describe the tumors. Then we talk about the puberty. I think everyone knows the puberty. What is puberty? The age where the secondary sexual characteristics starts to appear mainly, which is 12 to 15 for the girls and 13 to 16 for the boys mainly. Now what is the symptoms? Symptoms are going to be the complaints of the patient about his disease. Means the patient will be telling his doctor what the problem he has. This will be classified as the symptoms, whereas signs will be the objective findings which doctor will be looking in the patient to diagnose a particular disorder. When we talk about the symptoms, the patient will be describing as the fever, headache, nausea. When we talk about the signs, we will be having the paleness, cyanosis, dullness. This will be the signs. When we talk about the further terms, we have the diagnosis. The diagnosis is going to be mainly the identification or of the particular disease or the determination of the particular disease. Then we have the prognosis. The prognosis is mainly predicting or forecasting what will be the cause and ultimate outcome. Now we have the pyrexia. Pyrexia simply means the fever. Lesion means any sort of the injury. Then we talk about the inflammation. Now inflammation is widely discussed topic, but for now remember it is local reaction of the tissue in response to the injurious stimulus or the damageous stimulus. It involves swelling, pain, redness, warmth, loss of the function. These are mainly. Then we have the edema. The edema is mainly the swelling due to the accumulation of the fluid. Then we have the thrombosis and embolism, the two most important terms. We have thrombosis if there is the clot or solidification or coagulation of the blood in the specific part, and whenever this clot or solidified part of the blood detaches from the vessels and then move in the circulation, this is referred as the embolism mainly. Then we have the hemorrhage, means the rupture or the damage of the artery which results in the loss of the blood. Then we have the ulcer, means the breaching of some kind of the normal functional skin, mucous membrane, or anything else where we will be seeing the barrier is being specifically breached out. The sinus is normally used to define the blind opening or the track which is opening at the other end and it is closed and blind is the other one. Then we have the fistula. Fistula is going to be the abnormal connection present between the two ends and it is lined by the epithelium. Then we have the necrosis. Now what is necrosis? Necrosis is the death of the tissue because of the irreversible damage to the cell. It could be the damage to the nucleus, could be damage to the chromatins or the cytoplasmic proteins mainly. Then we have the degeneration, means the after the tissue has been undergo the necrosis, a series of the process which ultimately results in the deterioration of the tissues and therefore their structural and the functional characteristics. Next we have the gangrene. The gangrene normally means is a form of the necrosis which normally we will be identified clinically as being the black part of the body. It will be mainly the necrosis with the putrefaction. The putrefaction means the area is completely dead and the microorganism will start to attack and decompose it. Then we have the infarction. Infarction normally means the death or necrosis of the tissue because of the obstruction of the artery which supplies the oxygen mainly. Atrophy means the decrease in the size and number of the tissues because of the nutrition or the loss of the function mainly. Dystrophy is the normally change in the size. It can be of any type. Then we have the hypertrophy, which is increase in the size, whereas hyperplasia is increase in the cells, and hypoplasia means decreasing in the cell number, and this will be resulting in the incomplete development, whereas we have the aplasia, means failure of the specific organ to develop mainly. Then we have the syndrome. Syndrome is mainly going to be a collection of the symptoms and signs which will be constituting a particular disease mainly. Then we talk about the paralysis. Paralysis is the loss of the motor power when it is present on the one half of the body is referred as the hemiplegia. When it will be present on the both lower limb is paraplegia. For one limb is monoplegia, and for all limbs it's quadriplegia. Now the anesthesia is the loss of the touch and sensibility. The analgesia is the loss of the pain mainly. The thermoanesthesia means the loss of the temperature. The hyperesthesia means increased sensitivity mainly. The paresthesia is the abnormal sensations like the tingling. The coma is the deep unconscious states. The tumor or neoplasm is the uncontrolled divisions of the cells in the specific tissues of our body. Then we have the benign condition, which is a mild sort of the illness which will not be endangering the life. Then we have the malignant conditions, which is severe form of the illness which will be mainly resistant to the treatment and may culminate into the death as well. Then we talk about the carcinoma and the sarcoma. These are the type of the two malignant tumorous growth which we have. For the carcinoma, the tumor will be present in the epithelium. For the sarcoma, it will be present in the connective tissue. Remember, epithelium will be derived from the embryological layer called as the ectoderm or the endoderm, whereas connective tissue will be derived from the mesoderm mainly. Now, when we talk about the cancer, cancer is going to be a normally a general term we use for the malignant neoplasms mainly. Then the metastasis is mainly the spread of the cancer cells or local disease from one part to the distinct part of the body. Then we have the convalescence, means the recovery period between the end of the disease and the restoration of the normal functions or the health. Then we have the therapy, which is the medical treatment we normally prescribe to the patient for the treatment of the specific disorders or disease. So now we will be starting with the question, sorry, not the question, for the topic number. Now moving to the topic number 2, where we will be discussing the bones or the skeletal system mainly. Now first we will be talking about the classification of the bone. So whenever we talk about the classification of the bone, we need to remember the bones are classified on the different types, but one of the most important types is according to the shape. We have the long bones first. We have the long bones having the epiphysis, which is the two expanded end, and the diaphysis mainly. Then we have a typical long bones, which are mainly including the humerus, radius, ulna, femur, whereas miniature long bones, which will be only having a one epiphysis, like the metacarpals, metatarsal, or phalanges mainly. Then we have the modified long bones, which will be not having the medullary cavity. It will not be having a medullary cavity. This will be including the clavicle. Then we have the short bones, which will be mainly having the irregular or the rounded appearances, and this will be mainly including the tarsal and the carpal bones. The flat bones, which will be mainly the flat plate-like bones, which will be surrounding or forming the boundaries of the certain cavities of the body. This will be mainly including the skull, ribs, sternum, scapula. Then we have the irregular bones, which will be mainly including the vertebrae and hip bones mainly. Then we have pneumatic bone, which will be containing the large air spaces which are lined by the epithelia. Then we have the sesamoid bone, mainly the sesamoid bone, which will be mainly present or developed in the tendons of the muscles mainly. This will be including the patella, the pisiform, or the flabella bones mainly, flabella bones. Then we talk about further classification. We moved to the accessory or the supernumeracy bone, which are not always present, and these will be developed like the lateral tubercle of the talus, like tuberosity of the fifth metacarpals or metatarsals. Then we have the heterotropic bones, which are not produced in the normal condition, but they are produced whenever there is somewhat underlying stress, like it is commonly seen in the horse riders when they develop it, mainly because of the in excessive riding. It develops in the adductor muscles. Then we have the developmental classification. We have the membranous, cartilaginous, and membranocartilaginous. For the membranous, you guys need to remember the first architectural scaffold of the membranous bones or the dermal bones is being lined down as the membrane, and then they are later ossified to the bones. This will be mainly including the facial bones or the skull bones mainly. Then we move to the cartilaginous bone, which will be first laid down as the cartilage and later ossified to become the proper bones. Then we have the membranocartilaginous bones, which will be including both the membranous and the cartilaginous scaffold. before they are completely ossified to the bone. For the membranous bone, we include the skull and the facial. For the cartilaginous, we have the thoracic cage or vertebral column, whereas for the membranocartilaginous, we have clavicle, mandible, occipital. Next, we have the somatic bone, which will be present in the most of our parts of the body. Then we have the visceral bone, which will be derived from the pharyngeal arches, like the mandible, ear ossicles, or the hyoid bone. Then we have the axial skeleton and appendicular skeleton. The axial skeleton, which will be present close to the midline. This includes skull, sternum, thoracic cage, vertebral column. These are the typical axial region. Then we have the appendicular skeleton, which will be present away from the midline, including bones of the limbs mainly. Then further we have the further structural classification. Macroscopically, we have the compact bone, which will be consisting of tightly packed cells of the bone with very little intervening space, and these are perfect or adapted for the bending and twisting forces. Then we have the cancellous or spongy or the trabecular bone, which will be deposited as the meshwork. In between them there will be some of the space. This will be present mainly for the weight holding by the particular bone mainly. Next, we go for the microscopic examination. We have the lamellar woven bones. The lamellar bones are normal bones which are found in the humans, whereas the woven bones are normally found in the fetus or in fractures or in cancers or in other parts of the disease like the osteoporosis. We have the woven bones, the fibrous bone, which is present in the fetus, as well as it is not specific to the humans, present in reptiles and amphibians, whereas dentine and semen, which are the typical bones for the teeth mainly. Now, for the gross structure, we need to remember we have the shaft, which is also known as the diaphysis, which is surrounded by the periosteum, which is a fibrous membrane, which is attached to the shaft by the Sharpie's fibers mainly, and this will be also containing rich nerve and the blood vessels as well. You can see periosteum is very richly supplied by the nerves. Then we have the cortex, which is mainly the outer part of the compact bone, which is mainly made up of. Then we have the medullary cavity, which is mainly present in the medullary part of the bone, and this will be mainly involved in housing the bone marrow mainly. Then we have the two ends which are present opposite to each other, which we called it as the epiphyses, and these are involved in the articulation. Then in between them, there will be the articular cartilage present as well. Then we have the parts of the bone or young bone. We have the epiphysis, the metaphysis, which is present between the diaphysis and the epiphysis, and then another part is the epiphyseal plate of the cartilage. This part is mainly important in the deposition of the bone, and this is important for increasing the age, increasing the length of the bone with increasing age or increasing in the growth mainly. Then we move further to the blood supply. For the blood supply, we need to remember there is a big nutrient artery which will be mainly entering the long bone, and it will be dividing into the superior and the inferior branches. Then we have the periosteal arteries, which are mainly related or supplying the periosteum. Then we have the hairpin bands like arteries, the metaphyseal arteries, which are mainly the part of the or the arteries which will be piercing the bone at the metaphyses. Then we have the epiphyseal arteries, which will be piercing the bone at the epiphyseal end, and these are mainly important for the articulation or supplying of the joints as well. Now, we need to remember the direction of the nutrient foramen. We need to remember it will be away from the knee and it will be towards the elbow mainly. Now we have discussed what are the epiphyseal and what are the metaphyseal arteries. Remember, the metaphyseal arteries are most commonly present, which is suspected to the infections mainly. Now, when we talk about the nerve supply of the bone is mainly typically to the derived with the blood vessels and also to the periosteum as well. Now here you guys can see this is our cartilaginous ossification, where the bone is first laid down as the cartilage, and then it was later calcified into the proper long bone or the bone mainly.
Now, why we usually study it? Now, the medical legal aspect of this is we can use the bones for the determination of the age. We can use it to determine the sex. We can also determine the stature or height. This we can also identify the race as well. Now, when we talk about the cartilages, now we have to go to the three main types of the cartilage. We have with the hyaline, we have the fibro, we have the elastic. The hyaline will be normally found in the articular regions of the long bones, and this will be appearing as the bluish white or shiny or translucent or glossy in appearance. These are somewhat flexible mainly. This will be present in most of the joints, whereas fibrocartilage will be present in specific joint like intervertebral disc or the temporomandibular joint, the sternoclavicular joint, and this will be appearing as glistering white fibers because it contains abundance of the collagen ones, and it will be more firm, less flexible mainly. Then we have the elastic cartilage, which is specific to the specific locations. We have the penas, which is the external ear, the external auditory meatus, eustachian tube, the epiglottis, the arytenoid cartilages. This will be appearing yellow and this will be opaque. This will be containing numerous elastic fibers, which will be providing the flexible region. Now we will be moving to the chapter number 3, which is the joints mainly. Now, for the joint, remember we will be mainly describing it as the arthron or articulo. The arthron means when we talk about the joints mainly. Therefore, we talk it under the arthrology, synarthrosis, diarthrosis, which are the types. Now, when we talk about the structural classification, we have the three types of the joint: the suture, syndesmosis, gomphosis. Sutures, syndesmosis, gomphosis. We will be discussing it individually, but just for the timing, remember the names. They are important to remember. For the cartilaginous, we have the primary and secondary cartilaginous. Primary cartilaginous, also called as synchondrosis. Secondary cartilaginous, we called it as the symphysis mainly. Then the most important and the movable, the synovial joints mainly, which are ball and socket, saddle shape, condylar or bicondyloid, ellipsoid, hinge type of pivot, or the plane joints mainly. Then when we talk about the classification according to the movement, we need to remember the synarthrosis, which means a joint is immovable like fibrous. The amphiarthrosis, which is slightly movable like the cartilaginous joint. Then we have the diarthrosis, which is freely movable like synovial joints mainly. Now, moving further, we need to go further to the some of the typical terms which we have already discussed: the flexion, decreasing the angle; extension, which is increasing the angle; abduction, moving away, whereas adduction, moving back towards; rotation, we have already discussed; circumduction, and also we know what is the gliding as well. Now, another type of the classification of a joint is the mainly on the basis of the location, which is the skull, which is immovable; vertebra, which is slightly movable; limb, which is freely or highly movable. Now, according to the number of the bones, we can also divide it into the joints as well. The simple joint, which involve only two bones, like the scaphoid and the humerus, involving in the shoulder; the compound, involving more than two bones, which includes the humerus with the radius and the ulna involved in the elbow joint. Then we have the complex joint, which will be involving an articular disc in between them. We have the temporomandibular joint, we have the sternoclavicular joint. These are the typical complex joints which will be having the intervening cartilage or articular disc, which will be dividing into the two main articular cavities. Now we move to the fibrous joints. We have already discussed. We have the sutures, which are specifically located in the skulls, and further they are divided according to the base of the appearance. These are not so much important, but let us just remember the name. We have the plane, serrate, squamous, denticulate, and the scintillaceous. Remember, in fetus, the sutures are not completely joined with each other. There will be somewhat gaps, which we called it as the fontanelles mainly. Next, we have the syndesmosis. The syndesmosis involved with the bones which are united with the interosseous ligaments, like the inferior tibiofibular joint mainly. Then we have the gomphosis. The gomphosis is the peg and socket name for the mostly and only used for the root of the teeth, with the specific socket, mainly with its bony socket. Now, when we move further, we will be having the cartilaginous joint being classified as the primary cartilaginous joint, which will be containing the hyaline cartilage in it. So, therefore, they are known as hyaline cartilaginous joint. They are immovable and they are usually strong mainly. This includes the epiphysis and diaphysis containing the epiphyseal plate of the cartilage mainly. Now let's move to the secondary cartilaginous joint. We have the symphysis or fibrocartilaginous joint. This will be having the characteristic of the fibrous as well as cartilaginous one, means this will be permanent joint and these will be persisting throughout the joint, and these will be united by a special cartilage which we called it as the fibrocartilage mainly. This will be including the pubic symphysis or symphysis pubic. Then we have the manubriosternal joint or intervertebral joint mainly. Then we move to the synovial joint. We need to remember we have the plane joint which involve only one type of the movement, which is gliding movement. Uniaxial, which include the hinge and pivot. For the hinge, we need to remember will be allowing the flexion and extension. Pivot will be allowing only rotation. The condylar, which will be having the flexion and extension, with the ellipsoid will be allowing, like the condylar, flexion extension with the abduction and the adduction mainly. The multi-axial, we have the saddle and the ball and socket. Most of the function they share, but the saddle will not provide the circumduction mainly, while the ball and socket will easily provide the circumduction, while all the movements will be provided by the other movements will be provided by both the saddle and the ball and socket, which is the flexion, extension, abduction, adduction, rotations as well. But circumduction will be specific to the ball and socket mainly. Now, when we talk about the plane joints, we need to remember this will be allowing the gliding movements. This include the intercarpal, intertarsal. You can see this when we move the wrist or jerk the wrist. This is the normal joints, and we have the cricothyroid, the cricoarytenoid, which are the laryngeal joints mainly. Then we have the hind joints, which will be providing in the only flexion and extension. This will be including the elbow, ankle, and the interphalangeal joints. Remember, guys, knee is not the hind joint at all. Then we have the pivot joints, which allow the rotation. We have the superior inferior radial ulnar joint, atlantoaxial joint. These are normally the pivot joints mainly. Next, we move for the condylar or the bicondylar joints. We need to remember this will be containing two main rounded surfaces, the convex or the male surfaces fitting into the concave or the female surface mainly. This include the knee joint and the right and left jaws, which is also the temporomandibular joint. Then we have the ellipsoid joint, which will be present also between the convex male and the concave female surface, and it will be present between the metacarpophalangeal joint, the atlanto-occipital joint, and the wrist joint mainly. This will be producing the circumduction as well. Then we talk about the saddle or the stellar. These are specific to the locations. We have the first carpometacarpal, sternoclavicular, craniocuboidal joints mainly, which is present in the foot or the tarsals mainly. Then the ball and socket, the most common and the discussed joint, which allow the movement in every possible plane present. This includes shoulder, hip, incostapedial joint, which is present in the inner ear bones mainly. Now, when we talk about some terminologies, we need to remember male surface, which is convex, female surface, which is concave, simple joint, which has only two articulating surfaces, compound joints, which have more than one pair of the articulating surfaces, uniaxial involve movement in one plane, the biaxial involving the 2 degrees of the freedom, multi-axial involve 3-axis movement or multiple axis movements mainly. The translation is these sliding movements we normally uses. We have discussed what is the angular movement, what is the flexion, extension, abduction. We have to remember the two main terms for the rotation, the adjunct and the conjunct rotations mainly. The adjunct rotation is the independent rotation of the specific bones, whereas the conjunct rotation means when both bones usually move with each other during a rotation, whereas the adjunct will be only involving one of the bones be moving. Now, when we talk about the mechanical axis or type, we have the spin, which is the simple rotation of the bone along the mechanical axis. Swing, which will be the displacement. Avoid of the motion, which is the kind of circular motion. The cardinal swing, which will be movement in the shortest pathway. The arcuate, which where the movement in the longest pathway. Cos spin, when the adjunct rotation is closely related or is present with the rotation, whereas anti-spin, when the adjunct rotation usually nullifies the effect of the rotation mainly. Now, when we move to the synovial joint specific characteristic, we need to remember synovial joint will be containing a synovial fluid, which will be mainly containing the hyaluronic acid, and this will be providing the lubrication. Hyaline cartilage, which is the articular cartilage. Then we have the intra-articular fibrocartilages as well. Then we have the Haversian or the fat pads are present, which will be mainly occupying the extra spaces of the articular cavity and will be mainly enclosing the joint. Then we have a bursa, which is going to be mainly a synovial fluid filled bag, which will be providing uh, the fluidity, or what you can say, the friction to allow the tendons or the bones to mainly slide with easily. Whenever the bursa is inflamed, it is known as bursitis mainly. And when we talk about the blood supply of the synovial joint will be mainly derived from the epiphyseal arteries, which we have already discussed. Now, when we talk about the stability of the joints, we need to remember we have the stability being contributed by the muscles, the ligaments, and also the bones. The muscles, which will be mainly involved in holding the synovial joint, and the tone of their muscles is very much important in holding a specific joint, whereas the ligaments will be involved in holding the two specific bones. Then we talk about the bones. Obviously, the bones will be involved in holding a specific joint, or else the joint stability will be greatly reduced or hindered mainly. Now, let's start with the topic number 4. We have the muscles now. Muscles will be mainly derived from the mouse because it is named, because it contains. Now, if I draw a mouse, this will be his belly with a short tail. This is also the structure of the muscle. This will be having a large belly with a small tail, which we know it as the tendon mainly. Now, remember, there are three main types of the muscle: the skeletal, the smooth, and the cardiac muscles mainly. The skeletal is also known as striated, somatic, or voluntary muscles mainly. Each will be having an origin and insertion. Origin will be going to be the origin part, or from where the muscle originates, whereas insertion will be the part where it distally attaches. Origin does not move, it remains fixed, whereas insertion normally moves mainly. Remember, further, we move there to the, let's go with the chart. Now, remember, the striated is also present in the skeletal muscle, as well as the cardiac muscles are also striated. But the main difference is the multinucleation of these skeletal muscle fibers, whereas the cardiac muscle fibers will be uni or binucleated mainly. Striated muscle fibers are present in most of our parts, whereas the non-striated, which is also the smooth muscle, will be present specifically to the viscera mainly, the esophagus, the bladders, the blood vessels, the iris, whereas the cardiac will be specific to the heart. The striated muscles will be long and cylindrical. Smooth muscle will be spindle shaped, like somewhat like this mainly. This will be the shape of the smooth. This will be the short and cylindrical. This will be the structure of the cardiac. Another is that the fibers are unbranched for the both skeletal and the smooth, whereas cardiac will be containing branch fibers. Skeletal will be having multinucleated, non-striated or smooth muscle will be having the uninucleate, whereas cardiac is also uni or binucleate mainly. Remember, the blood supply as well. We have the blood supply for the skeletal is abundant, but the cardiac is also abundant. For the smooth, it is scanty. Another important structure is the intercalated disc. Intercalated disc is not present in the skeletal and the smooth muscle. However, it will be present in the cardiac muscles mainly. Now, when we talk about the The skeletal muscle, we need to remember, it will be striated, so the light and dark bands will be present in it. Also the cardiac muscles as well, but the smooth muscle would not be having them. Now moving to the part further, we need to remember the muscle have the fleshy part, which we know it as the belly, and the fibrous part, which is non-contractile or inelastic, or the terminal or the proximal parts. This includes either the tendon or the aponeurosis mainly. Tendon is cord-like, whereas aponeurosis is the sheet-like insertion mainly. So now we need to remember the basic structure. I hope everyone from the previous MDCAT or previous inter A levels have done this so far. We have the Z line, which is the connecting the thin filaments. Then we have the thick filaments, which will be connected by the H band and the A band, which is present in between them. Now, when we talk about the supporting tissue, we need to remember that there are the three main types: the perimysium, which surround the whole muscle bundles, which is individual muscle bundles, then epimysium, which surrounds the individual muscle fibers, whereas the no, sorry, there is a bit mix up. The endomysium, which will be surrounding the each muscle fiber, whereas the epimysium, which will be surrounding the whole muscle mainly. Further, we will be dividing it into the type 1 and type 2 mainly fibers. The type 1 fibers are those which shows the slow tonic contraction, and these are mainly for the those muscle which are appearing red in color because they have large amount of the myoglobin, and these are important for the aerobic metabolism, and these are for the long usage muscles mainly. They are highly resistant to the fatigue. Type 2 is mainly for the fast or rapid or phasic contractions, whereas intermediate, which will be the variant of the type 2 fast fibers, and also the slow fibers, mean they are resistant to the fatigue as well as they undergo the quick contractions. Now, when we talk about the fascicles arrangement, we have divided it into the four major types: the quadrilateral, the strap like with the tendinous endings, and the fusiform. When we talk about quadrilateral fasciculus, we need to remember it is commonly present in the thyrohyoid. Strap like is seen when there is sternohyoid or sartorius, whereas strap like with the tendinous insertion is present in the rectus abdominis mainly. When we talk about the fusiform, we need to remember we have the biceps brachii or the digastric, which will be having the two main bellies appearing the fusiform like structures. When we talk about the oblique fascicles, we have divided them into the triangular, unipennate, bipennate, multipennate, and circumpennate. Triangular will be containing the temporalis muscle. Unipennate will be containing only one side of the fan. Let me show you guys what is the unipennate. This is our unipennate, which will be containing only one side of the fan of the muscle fibers, and this will be containing the flexor pollicis longa, palmar interosseous, whereas bipennate will be having the fan on the both sides, the rectus femoris and dorsal interosseous, whereas multipennate will be containing the feathers or the wings are present whole over the muscle. This includes the deltoid, and the circumpennate will be mainly specifically related to the tibialis anterior mainly. Now, when we talk about the spiral or the twisted fasciculus mainly, the spiral or twisted fasciculus, you guys can see that some fibers are going here, some are going here, some are lying this, some are going this way. These are also called as cruciate muscles because they resemble the crux mainly, and this will be present in the sternocleidomastoid, masseter, adductor magnus mainly. Now, when we talk about the muscle, these are commonly named according to their fibers mainly and its appearance mainly. Now, when we talk about the shape, we have the classification on the basis of the trapezius, rhomboids, latissimus dorsus. According to the number of the heads, we have the biceps, triceps, quadriceps. According to the gross structure, we have the semitendinous, means the half is tendinous, other is the belly of the muscle, which is normal muscle fiber, semi-membranous, which is wide membrane-like. Then we have the, according to the location, the temporalis present in the near the temporal bone. Then we have the supraspinatus related to the supraspinatus fossa, intercostalis related to the intercostal space. Then we talk about the attachments. We can have the stylohyoid, means running across the in a stylohyoid process. Then we have the cricothyroid muscle, which will be connecting the cricoid and the thyroid cartilage. Then we talk about the action. We have the flexor carpi ulnaris, which is present on the medial aspect of the forearm, involving in the flexion of the wrist. Then on the direction of the fiber, we termed it as the rectus abdominis, present in the abdomen. Transversus abdominis, rectus will be having the straight fibers, transversus will be having the transverse or the horizontal fiber, whereas the orbicularis oculi will be having the circular fibers like this. A muscle with two bellies with the intervening tendon is called as the digastric muscle, which is commonly the term we use. Now moving further, we will be going to the nerve supply of the muscles. We need to remember there is 60-40%. 60% is mainly the motor supply and 40% are the sensory supply. Motor supply mainly including the large myelinated type alpha efferents, which will be mainly supplying the extrafusal fibers, which are the contractile fiber, whereas the small myelinated gamma efferents, which will be supplying the intrafusal fibers, which we called it as the muscle spindles as well. When we talk about the non-myelinated autonomic nerve fibers, these will be mainly supplying the smooth muscle fibers with the accompanied with the blood vessels mainly. And the sensory fibers, which are about 40% of the total. The muscle spindle are spindle-shaped sensory end organs of the skeletal muscles mainly. Now, here you guys can see these are mainly further classification of the fibers which are intrafusal. If the interfusal fiber are arranged in the chains of the nucleus like this, 1, 2, 3, 4 nucleus, these arrange in the chain, these are called as the nuclear chain fibers. While if the muscle fiber is being arranged like somewhat this, whereas the nucleus are mainly concentrated at the specific point, this will be giving the bag like appearance to give the nuclear bag fiber mainly. Now, we need to remember what are the primary and the primary sensory endings and the secondary sensory endings. The primary sensory endings will be mainly derived from the muscles, which is also called as the annulospiral endings, and this will be around the central region, whereas the secondary sensory ending is called as the flower spray endings, which is present on either side of the muscle fibers. Annulospiral endings will be mainly present in the center, and this will be around spiraling around the muscle fiber, whereas the flower spray will be spread like this on the muscle fiber. This is why they are named as the annulospiral and the flower spray endings. Now we talk about the motor unit. Motor unit is going to be defined as the single alpha motor neuron with the muscle fibers. It will be supplying it to produce a contraction. Then we have the composite or a hybrid muscle, which is supplied by the two different motor nerves, which include the adductor magnus, the pectoralis major. These are mainly supplied by the two nerves mainly. Now for the smooth muscle, we need to remember we have the single unit type and we have the multi-unit type. For smooth muscles, single unit type means seen in the intestine, means they will be mainly reaching one muscle cell and then it will be transmitted via the gap junctions to the other cells mainly. Whereas multi-unit will be supplied by the different endings each. Now, when we talk about the heart, this will be supplied by the autonomic fibers, the sympathetic and parasympathetic. Sympathetic will be stimulating the heart rate and blood pressure, whereas the dilating the coronary arteries, whereas parasympathetic decrease the heart rate and it mainly involved in the reflexes mainly. Now, when we talk about the actions of the muscle, we need to remember what are they. We have the agonist, which is mainly the prime movers, which is involved in producing a movement. And then we have the antagonist, which will be mainly opposing the prime mover. For example, when we talk about the flexion of the elbow, we have the agonist for the flexion. We have the biceps and the brachialis, which are the main agonists. When we talk about antagonists, for this we have the triceps mainly. Now, what are the fixators? Fixators are the group of the muscle which stabilize the proximal joint. So therefore, the distal joint movement can occur mainly. Whereas synergists are those muscle uh, which will be mainly produced when the prime movers crosses more than one joints. They will be nullifying the proximal movement of the specific joints mainly. These are produced because of these synergists mainly. Okay, guys, now we will be starting the cardiovascular system. Now, moving to the topic number 5, where we will be discussing the cardiovascular system. So now let's start. What is the cardiovascular system means? The cardiovascular system is being made up of two terms, the cardio and the vascular. So means it is made up of cardio means the heart, and the vascular means containing the vessels mainly. So now for the cardiovascular system, we will be starting first with the heart mainly. We know there is the two major divisions of the heart, the right side and the left side, which are further divided into the two components, the right atrium, the right ventricle, the left atrium, and the left ventricle. Here you guys know what are the outflow tracts. The outflow tracts of the right ventricle is the pulmonary trunk, whereas of the left ventricle, it is the aorta mainly. While when we talk about the input, the right atrium will be having the input from the superior and inferior vena cava, whereas the left atrium will be having the input from the pulmonary veins mainly. Now, when we talk about the basic terminologies, the first is heart. What is the heart? Heart is mainly the muscular chamber, which is divided into the four main regions, and it is mainly involved in pumping of the blood. The smaller region is called as the atria, which is the collecting chamber or the receiving chamber, as it is defined as. And we have the pumping chamber, or mainly the exerting the force chamber, the ventricles mainly. When we talk about the arteries, the main definition when you talk about the arteries is the vessel which carry the blood away from the heart to the tissues mainly. It is the correct definition. But when we talk about the general definition, most people uses the arteries to be defined as the vessels which carry the oxygenated blood. However, we do not use this terminology because there is the umbilical artery and also the pulmonary artery which carries only the deoxygenated blood. When we talk about the arteries, they will be branching like the trees which we know in different parts of the bodies. We need to remember there are two main types of the arteries. We either have the elastic arteries and we have the muscular arteries. The elastic arteries will be present near the aortas, and these are mainly responsible for resisting the changes in the pressure, whereas the other type of the arteries which are present near to the tissues away from the aorta will be the muscular arteries. These are mainly involved in the regulation of the blood flow to the particular tissues mainly. Now the arteries divide to produce the smaller arterioles mainly, which are the smaller arteries mainly. Now the angeion is going to be mainly derived from a Greek word which means vessel, and therefore the studies of the cardiovascular system or mainly the vessels is referred as the angiology mainly. Now, when we talk about the veins are usually mainly termed as the rivers which are meeting at the common point to produce the tributaries, whereas the arteries is produced as the branch of the branch like trees mainly. Now, the small veins will be present, which will be after uniting of the capillaries to produce the venules, which then usually join with each other to form the larger veins, which will be uniting with each other to form even larger veins, which are the vena cava. Respectively, on the upper part of the body or head is superior vena cava, while as inferior part will be containing inferior vena cavas. Now, what is the capillaries? Now, capillaries is going to be the microscopic vascular structures which will be connecting the arterioles and venules mainly. One thing we need to know or also the remember, they will be connecting the arterioles and venules mainly, not the larger arteries and veins, because the smaller arteries, which is also termed as the arterioles, will be involved in production of the capillaries or capillary bed mainly. Now, why these are important? They are important for the free exchange of the nutrients. They are involved in the metabolite drainage. Moreover, they will be some of the specialization of the capillaries where they are called as the sinusoids, which we will be discussing further. Now we have a further classification. The blood vessels is mainly on the five mainly groups which are normally used. We have the distributing vessels, and we have the resistance vessels, then we have the exchange vessels, the reservoirs vessels, and the shunts. Whenever there is distributing vessel, you guys need to remember this will be distributing the blood, which is the arteries. Then we have the resistance vessels, which will be mainly involved in the regulation. The smaller arteries, which is the arterioles, will be involved here. Then we have the exchange vessel, which will be including mainly the capillaries with the sinusoids, which is the modification of the capillaries. Then we have the reservoir vessel. Remember, whenever the word reservoir vessels came, it is usually applied to the large veins because they will be storing the excess blood. Then we have the shunts. Shunts is mainly the anastomosis or the communication between the two. We need to remember there are two main types of the circulations. We have the systemic circulation and then we have the pulmonary circulation, which are the two major divisions. Another main division which we see is the portal circulation, which is the part of the systemic circulation which carry the blood from the GIT organs towards the liver mainly. Here you guys can see this is our portal vein or portal venous system, which will be carrying the blood from the GIT tract to the liver, which will be rich in the nutrients and poor in the oxygens mainly. Now, when we talk about the general features of the artery, we need to remember they will be the thick walled, their lumen will be smaller, they would not having the valves, they will be having the elastic walls, and artery will be going to be accompanied either with the vein and nerve to produce neurovascular bundles, which is surrounded by the fibroareolar sheet mainly. Now, when we talk about the arteries type, we need to remember there are three main further divisions. We have the large artery, which are of elastic type, which will be resisting the pressure changes, which we have already discussed. The medium and the smaller one, which are mainly the muscular one, which will be involved in the regulation of the blood to the specific tissues. And then we have the smaller arteries, which is the arterioles, which will be dividing into to produce the terminal arterioles, and further it will be dividing into the meta arterioles, and finally it will be producing the precapillary sphincter, which will be feeding the capillary bed. Let me show you guys the diagram. Here you guys can see. Now this is the arteriole with the meta-arterioles, and then there is the precapillary sphincter, which will be feeding into the capillary bed mainly. Now, when we talk about microscopic structure, we need to remember the artery is made up of three layers: the tunica intima, the most innermost layer, which is lined by the epithelium. Then we have the tunica media, which is lined by the muscles, and the tunica adventitia, which is lined by the collagen fibers mainly. Now, one thing we need to remember, there is the blood supply of the arteries as well. Now, this sound a bit vague because the arteries is the part of the vessels as well. So, why do they need the arteries or the blood supply? Now, one thing we need to remember, the larger arteries are usually supplied by the blood vessels because they have numerous muscle fibers and elastic fibers and collagenous fibers. Therefore, they require nutrition to usually operate. That's why the larger arteries will be supplied by the blood vessels, which we called it as the vasa vasorum. The vasa means the vessels of the blood vessels. Okay, guys, remember the term. This is mainly the vasa vasorum, the vessels of the blood vessels mainly. Now, the rest of the walls will be mainly nourished by the diffusion, whereas the mainly adventitia will be supplied by this special blood vessels of the blood vessels mainly. The lymphatics are also present here, as we have already discussed. The adventitia will be containing most of the collagen and elastic fiber which requires it. Now, when we talk about the palpable arteries, there are some points or mainly the some arteries which we normally palpate to mainly take the pulses. We have the common carotid, the facial, the brachial, the femoral, radial. These are the common one. Now, when we talk about the nerve supply of the arteries, we need to remember there is the nerve supply also present for the arteries, which we known it as the nervi vascularis. Instead of vasa vasorum, we will be using nervi vascularis. Nervi means the nerves of the vessels mainly, which means the nervi vascularis. Now, when we talk about the skeletal muscle vessels, we will be having the sympathetic fibers for them, which will be dilated via the cholinergic fibers mainly. We will be discussing it further. The sympathetic usually decreases the diameter of the blood vessels. However, in the skeletal muscles, it increases the diameter. This is mainly because of the difference in the receptors And this is important because it increases the oxygen supply in case when we require the increased oxygen during the muscular activities. Now, when we talk about the exocrine glands, these will be supplied by the parasympathetic stimulation, like when we need salivation or when we need digestion. These are mainly produced. The vasodilation and the vasoconstriction are another phenomenons produced when we talk about the sweating or other kind of structures. Now, when we talk about the veins will be having the thin wall, unlike the arteries. The lumen will be larger. They will be having the valves. They will be forming because they will be flowing against the gravities mainly. The muscular and elastic tissue will be going to be sparse in it. In the smaller ones, it will be mainly absent. But as the as the venular diameter grows and it becomes the vein, um, it starts to accumulate bit of the elastic and the collagenous tissue mainly. Now, when we talk about the part 5, this is most important. The large veins have the dead space. What is the dead spaces? Dead space is mainly the empty space which may be dilated during increased venous return. Now, when we talk about the dead space, it will be containing the regional lymph nodes or housing mainly the regional lymph nodes as well. Now, these are the common table of the comparison of the arteries and veins. If you guys want, you guys can pause the lecture and can view it again, but we have discussed already. One thing we need to remember, the arteries are usually reddish in color because they will be carrying the oxygenated hemoglobin, which is Hb4O2. But the veins are bluish in color because they will be carrying either the plain hemoglobin or the hydrogenated hemoglobin or the carbon dioxide containing hemoglobin mainly. Rest we have already discussed. Now let's move on to the blood vessels and nerve supply of the veins. Like the arteries, it will be also having the blood vessels been supplying the larger veins, which we know it as vasa vasorum. Whereas for the nerves, we have the nervi vascularis present as well. Now there are some of the factors which will be helping the venous to return because it is against the gravity. We have the overflow from the capillaries. The another one, the gravity, if it is favoring it, some of the vessels only, like in the upper part of the body. Negative intrathoracic pressure, which is important for sucking of the blood into the heart. Then we have the arterial pulsation. Remember, the arteries, veins, and nerves are usually bundled together as the neurovascular structure, and the arterial pulse create a pressure which allows the veins to just be expand and the blood to flow much more easily through them. Then we have the most important structures of the all, the venous valve, which are involved in preventing the regurgitation, which means the backflow of the blood. Now, when we talk about the capillaries, we need to remember something very important for them. The capillaries, which will be normally about 6 to 8 microns in diameter, but the size of them usually varies according to the different organs. Normally, there are continuous capillaries present in most of our structures. We have the continuous capillary, which will be having no gaps in its wall, so therefore it is continued like the tube, and it will be mainly present in the skin, connective tissue, skeletal muscles, smooth muscles, lungs, and brains. Remember, it will be present in specific those locations where the lymph flow is not that much. Now, when we talk about it, another type of the capillary, we have the fenestrated capillaries. Now, what are the fenestrated ones? The fenestrated capillaries will be containing some of the pores in its wall, which allow the blood or its formed elements to leak out from the capillaries even more than normal. These are specific to the endocrine glands and the pancreas mainly, and also the renal glomerulus as well. Now, another type of the characteristic the capillaries usually possesses is the sinusoidal capillaries. Now, the sinusoids are mainly the special type or mainly the modification of the capillaries, which will be present in the specific location like liver, spleen, bone marrow, suprarenal glands. But unlike the fenestrated capillary, which will be containing only small pores, the sinusoidal capillaries will be containing large spaces in it, which allow the formed elements of the blood to pass through it easily, which include the red blood cells, even white blood cells, some pathogens mainly. Now we have already discussed the characteristics. Let us discuss once again the characteristic. Their lumen will be somewhat wider, their walls will be thinner, and they will be connecting the arterioles with the venule, but their walls will be incomplete, which will be lined by the endothelium, where the phagocytic cells like macrophages will be distributed and looking out or monitoring the contents of the capillaries mainly. Now, when we talk about the anastomosis, what does the anastomosis means? The anastomosis can be the precapillary or it can be a postcapillary. It means communication between the vessels is defined as anastomosis. Literally means the collateral circulation. What does it importance lies? That if one of the vessel is blocked, the other vessels can compromise it. Now, there are the three major types: the arterial anastomosis, which are normally present between the arteries mainly, like we have for the plantar arch, the palmar arch, the circle of the villus of the brain, then intestinal arches. These are the actual arterial anastomosis. Then we also have the potential arterial anastomosis, where the communication take place only between the terminal arterioles mainly. Now, similarly to the arterial anastomosis, there will be the venous anastomosis, which will be the communication between the veins and its tributaries. When we talk about it, we have the dorsum of the foot, and the hand will be having the venous anastomosis to produce the dorsal carpal venous arch and the dorsal plantar venous arch as well. Now there is another type of the anastomosis which is very rare, which is called as AV anastomosis, the atriovenous anastomosis. Normally this is not present. It is an anastomosis, as its name suggests, between an artery and vein. This is normally present in the embryo and some of the abnormal connections as well. Now let's move on to the terminal end arteries. Now what are the end arteries? The term end arteries means those terminal branches of the arteries which do not anastomosis with any other neighbors. These are called as end arteries, and these are especially vulnerable to the organ damage if they are being blocked or mainly hemorrhaged. Now, when we talk about these example, they have the central artery of the retina, the central branches of the cerebral arteries, the arteries of the spleen, kidney, and lungs. These are the common main branches mainly. Now, when we move to the topic number 6, which is the lymphatic system. Now, when we talk about the lymphatic system, it will be containing the minute lymphatic vessels which will be carrying the special tissue fluid which is called as the lymph away from the tissues towards the veins mainly. Here you guys can see in this diagram, it will be carrying the fluid which is leaked out, which is the tissue fluid, from the tissue spaces all the way back to the veins mainly. Okay, this is the mainly the term. Now when we talk about the components of the lymphatic system, we need to remember there is divided into four major: the lymph vessels, the central lymphoid tissues, the peripheral, and the circulating lymphocytes mainly. Now when we talk about the lymph vessels, they, unlike the blood capillaries, they are usually very much thin and also blind. Means they do not have the closure at their proximal end, they are only closed at the distal end mainly. Okay, and they will be colorless in nature, unlike the blood capillaries, which will be reddish mainly. They will be wider than the blood capillaries, they will be having more caliber in it. As the term suggests, their caliber will be greater and less regular mainly. Moreover, they will be collecting the colorless lymph, which is the tissue fluid as well, instead of the blood. There will be very low pressure in the lymph, and there will be also valves present like the venules in the lymphatic vessels mainly. Now the lymph capillaries will be joining to form the lymphatics, which will be the superficial and deep lymphatics, which will be accompanying the superficial and the deep veins respectively. Now, eventually all the lymph will be mainly drained into the two main structures of our body, the two main big lymphatic trunks, the thoracic duct and the right lymphatic duct, which will be emptying the lymph which will be obtained from most of the lower body to the venous angle, which is produced at the brachiocephalic veins. They will be mainly draining the lower limbs, abdomen, left half of the thorax mainly, whereas the right lymphatic duct will be mainly draining the right halves of the thorax, neck, and the upper limb mainly. Now, when we talk about the central lymphoid tissues, we need to remember this comprises of only the two main organs which are involved in the development of the lymphocytes, the bone marrow and the thymus. As we have already discussed, there are two main types of the lymphocytes, the B and the T lymphocytes. And as the name suggests, the B will be mainly developing in the bone marrow, whereas the T will be developing in the thymus respectively. Now, when we talk about, this is the diagram of the area being drainage, which we have already discussed. Now, when we talk about the T lymphocyte, they will be housing mainly in the thymus in the embryos, and when they are mature, they will be converted into the T lymphocyte, which will be leaving the thymus and then will be circulating in the blood and eventually being stored in the peripheral lymphoid organs. Now, when we talk about the peripheral lymphoid organs, we need to remember there is the lymph nodes, spleen, and there is epithelial lymphoid tissues. Now, I think everyone knows what is the lymph nodes. The lymph nodes are specialized structures of the tissues which are present interposed between the lymphatic vessel. The spleen is another organ of our body. But what is the epithelial lymphoid tissue? As its name suggests, it will be a collection of the lymphoids in the epithelial tissues. This is normally applied to the respiratory tracts and the gastrointestinal tracts, where we have it as the GALT, which is gastric associated lymphoid tissues, or in the respiratory tissue, we called it as MALT. So in GIT, we called it as a GALT, which is the gastric associated lymphoid tissue, or GIT associated lymphoid tissue, but in um, respiratory organs we call it as MALT, which is the mucosa associated lymphoid tissue. However, the MALT is also the term normally used in the GIT as well for the pious patches in ileum mainly. Okay, so the epithelial lymphoid tissues will be the collection of the lymphoid organs in the epithelial tissues. When we talk about the circulating pool of the lymphocytes, normally the lymphocytes, the containing the B and the T lymphocytes are usually stored in the peripheral lymphoid organs, but they are not present in the blood, but they enter in the blood in case of the infection or emergencies mainly. Now we talk about the lymphatic follicle, which is also called as the lymphoid nodule mainly. Now, what is this structure? This is the structure which is produced by the collection of the lymphocyte at the specific part of the body. Now, we need to remember two things here. The follicle will be containing a specific center, which we called it as the germinal center, where the lymphocytes are more loosely packed and they will be much more activated, as they will be staining less deeply and will be dividing more rapidly. Why will they staining less deeply? This is mainly because their chromatin will be highly expressed, which is, as everyone have studied in the histological class, it will be mainly derived, it will be containing mainly the euchromatin, which is taking the stain very light, and therefore they appears very light. Now, what are the lymph nodes mainly? Now, remember, the lymph nodes are the nodules of the lymphoid tissue which are collected with each other to produce the lymph nodes, and they are interposed in between the lymphatic vessels mainly. Now, remember, the lymph nodes are arranged at the specific locations of our body. We have the preauricular, the occipital, the postauricular, the mandibular, the buccal, the submental lymph nodes. We can have the deep cervical lymph nodes, superficial cervical lymph nodes. These are the common example of the lymph nodes only in the neck. They are present in all over the body. For the lower limb, we have the femoral, we have the popliteal, Well, for the upper limb, we have the axillary nodes, the most important of all. Now, when we talk about the drainage of the lymph, we need to remember this line. This line is usually passing through the umbilicus or the belly button. But when we talk about this line, any lymph nodes or vessels present above this will be drained into the axillary lymph nodes. Like if we talk about the thorax, will be drained into the axillary lymph nodes, whereas the other lymphatic vessels which are present below the line will be emptying into the inguinal lymph nodes, which are present at the inguinal region, which is the junction of the abdomen and the lower limb mainly. When we talk about the section of the lymph nodes, so here you guys can see this is the typical structure of the lymph node. Here you guys can see we have the afferent lymphatic vessel which will be feeding the lymph node, and there is the efferent lymphatic vessel which will be emerging at this structure which we know it as the hilum mainly. Now remember, the lymph node will be dividing into the two layers, the outer layer which we call it as the cortex, whereas inner layer is called as the medulla mainly. Now the cortex is further divided into the two regions, the first the outer region and the another inner region where we called it as the paracortical area. The paracortical area importance is that it will be specifically housing the T lymphocytes mainly. Cortex is mainly further divided into the three layers. We have the zone 1, 2, and 3 mainly. Remember, guys, zone 1 will be containing loosely packed lymphocytes with the macrophages, with sometimes the plasma cells mainly, which are present near to the medullary cords mainly. Here, this is our medulla, and this will be containing small cord-like structure like this, the medullary cords mainly. Then we have the zone 2, which is present more densely packed lymphocytes and macrophages. And then we have the zone 3, which will be containing the germinal center with the mature large lymphocytes and macrophages, which are usually activated. Now, what is the medulla? Medulla is going to be the central part of the lymph node, which will be containing loosely packed lymphocytes, which are mainly passing through the medullary cords, and after passing through this, they will be entering the efferent lymphatic vessels eventually to enter the blood mainly. Now, when we talk about this is another type of the section which we have already discussed. There is the zone 1, 2, and 3. Zone 1 being the innermost, containing the lymphocytes, and then we have the zone 2 and the zone 3 respectively. Here you guys can see this is the typical outlines. Now, what is another type of the structure? We call it the hymal nodes mainly. Now, what is the hymal nodes? The hymal nodes, as the name suggests, these will be the small lymphatic bodies like the lymph nodes, but they will be present at the course of the blood vessel instead of the lymph vessels. As the term hymal means related to the heme, which is the blood. So what is the hymal nodes? These are like lymph nodes, will be present at the different parts of the body, but unlike the lymph nodes which are related to the lymphatic vessels, they will be related to the course of the blood vessel mainly. Now, next we go for the another important part of our immunity, which we know it as MPS, the macrophage mononuclear phagocyte system mainly. Now, what does it mean? It is also alternated with the radiculoendothelial system. It consists of the specialized macrophages at specific locations in our body which are concerned in protecting our body against the disease. We have the macrophages of the connective tissues, the monocytes which are present in the blood, the liver macrophages, which named it as the Kupffer cells for the meninges. We have the meningiocytes for the central nervous system. We have the microglial, but for the foreign body, we have the giant cells mainly, which are produced mainly by the union of the different macrophages to unite to produce a single large cell, which is called as giant cells. These cells are important mainly to destroy those pathogens which are normally too large to be ingested by the normal phagocytes mainly. Now remember, the phagocytosis or the engulfing activity is also present in the endothelial cell, fibroblast, and the leukocytes as well. But their activity is relatively poor, and therefore they are not classified as the MPS system. Now, when we talk about these functions, we need to remember this will be involved in the first line of the defense. They are non-specific mainly. Then the macrophages of the lymphoid tissues are usually also concerned to elicit the immune response, and most of the prominent site are mainly the site for the hemopoiesis, which is the generation of the blood form elements as well. Okay, guys, this was about the lymphatic system mainly. Next, we will be starting the nervous system. Continuing with the topic number 7, we will be starting with the nervous system. So now, what is the main function of the nervous system? Nervous system is mainly involved in the nerve conduction, which is the transfer of the signals from the surrounding to the body mainly. It can be divided into the two major types. The nervous system is divided the CNS and the PNS mainly. The CNS include the central nervous system, which include the two main structures present centrally, the brain and the spinal cord. The brain is also known as encephalon, and this will be mainly present in the cranial cavity in the skull, and this will be containing mainly the higher centers, which help us to mainly perform most of the voluntary function, help us to think and help us to speak, and most of the function we perform. Then we have another important structure, which is the spinal cord or spinal medulla. The spinal cord or spinal medulla is mainly those structure which will be mainly involved in the integration of the information from the periphery to the central nervous system, or from the central nervous system to the periphery mainly. Moreover, it is also the type of the relay organ, means the signals from the brain will be terminating it here before moving to the peripheral parts mainly. Now, when we talk about the cross section of the spinal cord, this is one of the most frequently asked. So now, when we take a transverse section of the spinal cord, we will be seeing two main matters: the gray matter and the white matter. Here, guys, you can see the H shape. This is our gray matter, while out on the outskirts, these are the white matter mainly. Now, you guys need to remember the gray matter is divided into the H shape, and this will be containing the anterior horn and the posterior horns mainly. Now, remember, the anterior horn will be mainly the site for the immersion of the motor root, whereas the posterior horn will be the site for the termination of the sensory root or sensory fibers mainly. And remember, once we move further from the cord to its roots, it will be dividing into the ventral root and the dorsal root mainly. Now, remember, there is two main roots: the ventral root, which will be containing only the motor fibers, and the dorsal root, which will be containing only the sensory fibers. Now, with the dorsal root, there will be the dorsal root ganglia, which is mainly the collection of the cell bodies mainly. Then they will be united with each other, and therefore they will be producing the spinal nerve here. Now, once the spinal nerve is produced, it will be dividing into the two main components: the ventral rami and the dorsal rami mainly. Now, remember, the ventral, this will be called as the ramis mainly. Now, the ventral and the dorsal rami, unlike the ventral and the dorsal root, will be carrying both the motor as well as the sensory fiber. The ventral rami, when we talk about, which is present on the anterior aspect, this will be mainly involved in supplying the limbs and the most of the anterior part of the trunk. When we talk about the dorsal rami, this will be mainly involved in supplying the back with the skin and its musculature. This is the dorsal ramus, mainly or dorsal rami. Now, when we talk about further, we have the PNS mainly. Now, PNS is mainly consist of the cerebrospinal nervous system. Now, what does the cerebrospinal nervous system means? It will be involving the collection of the nerve fibers, which will be passing all the way from the either the cerebrum or from the spinal nerves to the different roots of the body. This will be including 12 cranial nerves, which will be passing from the cerebrum or the brain, whereas the 31 pairs of the spinal nerves, which will be passing from the spinal cord mainly. Now, we have another very much important system of the nervous. This is the autonomic nervous system. Now, what does the autonomic nervous system mean? Autonomic system means those system which we cannot be controlled by ourselves. So this will be including the involuntary system, divided into the further two main types, the sympathetic and the parasympathetic divisions mainly. Now, when we talk about the different types of the cells present in the nervous system, the first we will be having the neuron. Neuron will be further divided into the, this you can guys can see, this is our cranial and the spinal nerves. The neuron will be having the typical structures. Let me show you. Yes, this is, you can see this is our cell body or soma with the signals coming in, which is the afferent pathway, the dendrites, and also the axon, which is mainly the efferent pathway or the outflow with their some of the neurons will be myelinated to by the myelin sheath to produce the node of the Renwier, which is the spaces between the myelins. And terminally, they will be dividing into the terminal butons mainly. So this is the typical structure of the neuron means. Now, when we talk about the types of the neuron, we need to remember there are the different types. We have the unipolar neuron, which have only one end present. This is the unipolar, but further unipolar is classified as the pseudo unipolar. Here you guys can see this is the unipolar as well as the pseudo unipolar. Unipolar because it is only one process, but the correct term to define this neuron is pseudo unipolar, because just after it give this the division, it will be dividing into the two parts mainly. So this is the pseudo unipolar. The pseudo means false, means it is the unipolar, but unlike unipolar, it does not appear like the typical unipolar neurons mainly. But if I can draw for you guys, so you guys need to remember this is will be our soma and this is our normal unipolar neuron instead of the pseudo unipolar neuron. When we talk about the unipolar and pseudo unipolar, these are mainly found in the sensory or the spiral ganglia mainly. When we talk about the bipolar neuron, this you guys can see, this is our bipolar neuron, the two ends on the different sides of the cell bodies emerging from the neuron, and this will be mainly present in the special organs, which includes eyes as well, which is the bipolar neurons of the retina, and also the organs of the hearing, so spiral and the vestibular ganglia mainly. Now, another important classification of the neuron is based on their length of the axon. That is Golgi type 1 and that is the Golgi type 2. Now, Golgi type 1 will be having a long axon, whereas the Golgi type 2 will be having either a short or it will be having no axon mainly. Now, when we talk about the another important concept, there is the dynamic polarity. Now, what is the dynamic polarity? The dynamic polarity is that each neurons will be conducting the nerve signals from the dendrites towards the soma and then away from the soma, then into the axons mainly. However, remember, whenever these pathways are not always fixed and when there are multiple axons clustered together, this can also occur in the reverse direction as well. Means from the axon, the signals can come and the dendrites can act as the outflow tract mainly. But this is very rare. However, it can occur. Now, when we talk about another important term, we need to remember about synapses. What is the synapse? Synapse is mainly going to be the junction present, which can be between the two neurons or it can be between a neuron or a muscle to produce the neuromuscular junction mainly. Next, we move to the neuroglias. Now, what is the neuroglial? The supporting tissue, which is non-excitable supporting cells of the nervous system, are classified as the neuroglial, which will be further divided into the five main types. We have the ependymal cells, the neuroglial cells, the capsular or the satellite Schwann cells, and the other ones. Now, when we talk about neuroglial cells, these will be present in the parenchyma of the brain and the spinal cord. Then we talk about the ependymal cell. This will be present in the cavities, which is the containing the CSF, which is the cerebrospinal fluid in the brain. It will be present in the ventricles, whereas in the spinal cord, it will be present in the spinal canal or in spinal cavity. When we talk about the capsular or the satellite cells, remember guys, this is one of the most important cells which are present. Now, continuing with it, we have the capsular cells, which are the most important one. and this will be belonging to the autonomic nervous system containing ganglia. Now, what is the ganglia? Ganglia is mainly the collection of the neuronal cell bodies in the particular location of our bodies, and this will be mainly surrounded by the specialized structure which we call it as the capsular cells mainly. Now, moving on, we need to go with another important cell. We have the Schwann cell. Obviously, the Schwann is one of the most discussed neuroglial cells, and this will be involved in producing the myelination of the peripheral nerves mainly. Now, when we talk about the neuroglia, we will be further dividing it into the two main structure, the microglia and the macroglia. Microglia will be mainly the part of the MPS, which is the monocyte macrophage phagocytic system, and we also have the macroglia, which will be mainly derived from the ectoderm, and these are further divided into the three categories: the astrocytes, the oligodendrocytes, and the glioblast mainly. Now, when we talk about the astrocytes will be serving most of the important functions of the all. Means it will be involved in various synaptic junction. It will be performing various functions in our CNS mainly, but further astrocytes is divided into the two main criteria: the protoplasmic astrocytes, which is thick and symmetrical, present in the gray matter only, whereas we have the fibrous astrocyte, which is thin and asymmetrical, present in the white matter only. Now, moving on, we need to again touch another important cell, which is the oligodendrocytes mainly. Now, oligodendrocytes is the most important cell when it comes to the myelinations of the neuron within the CNS. It is the oligodendrocytes. Now, it will be further divided into the intrafascicular or perineuronal cells. The intrafascicular, as its name suggests, it will be mainly related with the fascicles or tracts. So, this will be involved in myelination of the tracts, whereas perineuronal cells, which will be present between the soma of the neurons mainly. Now, when we talk about glioblast, the glioblast, another important cell, which is mainly the stem cells, which will be dividing into the macroglia or to differentiate into any of the populations of the macroglials. Now, when we have the microglia, we have already discussed it will be the phagocytic in nature in the CNS, and they will be performing most of the phagocytosis mainly. Now, when we talk about another important concept, there is the blood-brain barrier. Now, when we say the blood-brain barrier, it is a barrier produced in the brain to prevent the formed elements or proteins or any dyes to enter or infectious agent to enter from the blood into the brain mainly. Now, it is produced from the three main structures: the capillary endothelium of the brains, which will be containing no fenestration. With that, it is surrounded by the basement membrane, which is also having no opening, and this will be also continuous, and moreover the end feet of the astrocytes, which will be covered by the capillary walls mainly. When we talk about the reflex arc, we need to remember the reflex arc is produced as the direct or involuntary contraction produced on the action of the specific stimulus. It can be comprised of the receptor, which is going to be mainly present, and it can be skin. It can be comprised of the afferent neuron, which will be taking the signals, the efferent neurons or the motor neuron with the effector, which will be producing the action. It can be a muscle or it can be gland, respectively. Now, when we talk about the peripheral nerves, we need to remember they are further differentiated on the basis of the coverings mainly. Now, individual nerve fiber is covered by the endoneurium mainly. Now, when they are collected into the fascicles or mainly the bundles, they will be surrounded by the perineurium, and in the whole nerve trunk will be surrounded by another connective tissue structure, the epineurium mainly. Remember, there is a total 31 spinal nerves which are present, but 31 pairs of the spinal nerve which is present on the right as well as on the left. This will be including the 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and the 1 coccygeal divisions each. Now, moving on, we need to remember the normal basic terminologies which we have already discussed about the spinal nerves mainly. Now, what is this? This is called as the dermatomal pattern. Now, what is the dermatomal pattern? The dermatomal pattern is the specific area of the skin supplied by the one or the two roots of the nerve mainly. Here you guys can see, if I talk about the umbilical region or the umbilicus region, it will be supplied by the T10. If we talk about the neck region, it is supplied by C3 and C2 mainly. So what is dermatome? Dermatome is a patch or the area of the skin which will be going to be supplying the individual skin or area of the skin mainly. Now, when we talk about the nerve or the spinal nerves, we have remember there is the ventral and the dorsal divisions of the each. Now remember, the ventral rami or mainly the anterior rami is involved in production of the plexuses. Now what is the plexuses? Plexuses is going to be mainly the interlacing or compositions of the fibers of the different nerve roots coming together, uniting with each other to produce us another nerve. Here you guys can see this is our C5, 6, 7, 8 and the T1 mainly. Now what you guys can appreciate it that each branch will be containing some of the contribution from C5, C6 or C7 as well, while the lower branches will be having the contribution from C8, T1 and the C7. So it is involved in making the contributions from different nerve roots to produce a large nerve fiber mainly. Now remember, when we talk about the nerve fiber, we will be having the two types of it, the myelinated and unmyelinated. The myelinated outside the CNS will be myelinated by the Schwann cell, whereas inside the CNS it will be myelinated by another very important structure which we called it as the oligodendrocytes or the oligodendroglial as well. Here you guys can see this is our Schwann cell which is wrapping around the axon and producing the myelination around it. Now, moving on, when we talk about the non-myelinated fibers, what is their significance against the myelinated ones? Now, remember, the non-myelinated would not be having the myelin, so therefore their conduction speed will be much way lesser than the usual. However, they will be mainly related to the Schwann cell, which will be not involved in the myelination, but generally it will be involved in providing the trophic nutrition to this. Now, when we talk about the classification according to the function, we will be dividing the nerves into the different structure. Now, the first is GSE, which is general somatic efferent. Now, remember, the name will be suggesting its function. The general means the general function, S means somatic, means most of the functions of the muscles or body related, and E is mainly efferent, means it is an outflow tract mainly. So now remember, the general somatic efferent is involved in supplying these striated muscles of the somatic origin mainly, which will be mainly including the cranial nerve 3, 4, 6 and the 12 mainly. Now when we talk about the special visceral efferents mainly, now it takes special visceral efferents. The same terminology will be indicating us. The special means it will be not normal, means it will be derived from special locations. V means the visceral, means it is related to somewhat visceras, and E is mainly the outflow tract. Now when we talk about the SVE, it is also known as the brachial efferents, which will be involved in supplying the striated muscle derived from the pharyngeal arches mainly, which is the branchial origin. This will be including the 5, 7, 9, 10 and the 11 nerves. Then we have the general visceral efferent, which will be GVE. As the name suggests, there will be the general pathway from the visceras to the it will be providing the outflow from the visceras. This will be mainly involved in the secretion of the various visceras as well as the contraction of the smooth muscle. This will be involved in the 3, 7, 9, 10 nerves. You guys need to remember this. Now next we have the GVA, which is general visceral efferents. As the name suggests, it will be containing or mainly transferring the efferent signals, which is the general sensation signals from the visceras mainly. Now when we talk about SVA, the special visceral efferents mainly. Now the special visceral efferents will be carrying mainly the taste or anything else like balance. Now for this we need to remember it will be mainly involved by the cranial nerve 7, 9 and the 10 mainly. Then we also have the general somatic efferent. As the name suggests, it will be general. Somatic means it will be carrying from the normal parts of the body. Efferent means it is mainly the input signal. So it will be mainly carrying the touch proprioceptive impulses. But when we talk about special somatic efferents, we need to remember it will be mainly carrying the signals of the smell and the vision mainly. or as well as the hearing and equilibria, which is the part of the cranial nerve 8. Now, moving on to the further concepts, we have divided the nerve fibers into further divisions, the group A, B, and the C fibers mainly. Group A will be mainly the thickest and the fastest of the myelination. They will be more myelinated. Group B will be also myelinated, but they will be medium sized. Group C will be thinnest and slowest, non myelinated. They will be having way more speed, and this will be having lesser speed, and this will be having very slow speed present mainly. The group A is mainly related to the skeletal motor fibers, whereas the group B is mainly involved in the preganglionic autonomic efferents. And then we have the group C, which is involved in postganglionic autonomic efferents mainly. Now we have discussed the autonomic nervous system. The autonomic nervous system comprises of the two main pathways. We have the preganglionic neurons, which will be mainly those neurons which will be conducting the neurons to a chain, which we called it as the ganglionic chain. Let me show you guys. Now this is our ganglias mainly. Here you guys can see this is also our ganglias. Now remember, whenever there is the preganglionic fiber, it will be carrying the fiber from the spinal cord and will be terminating into the ganglia mainly. Now this is our preganglionic fiber. Then we have the postganglionic fiber, which will be emerging from the ganglias mainly. It is also the ganglia. So we will be all dividing these fibers on the basis of the two terms, the sympathetic as well as the parasympathetic. Now the sympathetic will be related to the sympathetic trunk, means it will be having a short preganglionic fiber and a long postganglionic fiber mainly. While for the parasympathetic, there will be the reverse. Instead of the ganglias being present in the sympathetic trunk, the ganglias will be present near the visceras or the muscles. So there will be large preganglionic neuron which will be traveling all the way and will be mainly reaching the ganglia present near the visceras or on the visceras. It will be passing through the sympathetic trunk, but it would not be synapsing with it, unlike the previous sympathetic divisions which will be synapsing in the sympathetic trunk. Now, once it reaches the nearby ganglia, the parasympathetic preganglionic fiber will give us the postganglionic fiber, which will be supplying mainly the visceras mainly. Now remember, the two systems are very much important in their aspects. The parasympathetics are mainly involved in our relaxed systems, but it is produced by the different divisions. Now the parasympathetic is produced from the cranial nerve 3, 7, 9, and 10 mainly. Here you guys can see, and also the S2 and S4 division, where a sympathetic is specific to T1 to L2 only. The parasympathetic is also called as the craniosacral flow, and the sympathetic is called as the thoracolumbar flow. Now, when we talk about the parasympathetic, we have already discussed the preganglionic fibers will be way longer, whereas for the sympathetic, the preganglionic will be shorter and the postganglionic will be longer. And like parasympathetic, postganglionic will be shorter one. Now, normally the parasympathetic is involved in the scene of the relaxing, and it will having no effect on the skin, whereas sympathetic will be involved in the vasomotion, the pseudomotor, pilomotor. It is involved in the emergency situation, which is the 3Fs, the fight, flight, or fright mainly. Now we will be moving to the another neuronal important terminology. Here you guys can see this is the clinical correlate, the Bell's palsy. Now what is the Bell's palsy? The Bell's palsy is produced whenever there is a lesion of the facial nerve on the side of the face mainly. Remember the importance of the facial nerve. It is involved in the supplying of the muscles of the face. As the facial nerve is severed, the facial muscles will now have no longer their normal position, therefore they will be mainly drooping downwards. This is the classic feature of the Bell's palsy mainly. Now moving on to another topic, the last topic is the skin and the fascia mainly. Now what is the skin? Now skin is also called as the cutis, derma, or integument. and it is the covering produced on the external surface of our body, also the external auditory meatus, which is the pathway in the ear, as well as the tympanic membrane outer surface as well. Now when we talk about the surface area of the skin, it is one of the most important one, and this will be depending upon the age and the also the height of the individual. Now when we talk about the pigmentation of the skin, this is produced mainly, this is the normal, the distribution for the burns all over the body for the adult as well as for the children as well. Now when we talk about the important pigments which is involved in giving the skin its color, this include the most important of the all, the melanin mainly. And like the melanin, the melanoid, both will be somewhat same, which will be present in the skin just under the epidermis, and this will be providing the skin this typical color and will be helping the differentiation on the basis of the race. When we talk about the Caucasians, they will be having the melanin present in the lower quantity, whereas when we talk about the Afro-Americans or the Americans, or even when we talk about the Africans, they will be having much more quantities of the melanin. Now, when we talk about the carotene, this will be a yellow-orange pigment which is present in the stratum corneum, which is the division of the skin, and it will be also obtained from the diet as well, and this is also involved in producing the small amount of the pigment. Now the two other important structures involved is the hemoglobin and oxyhemoglobin. Remember, the hemoglobin is purple or bluish purple in color, so therefore when there is lack of the oxygen, we see cyanosis, which is the bluish discoloration of the skin, whereas the oxyhemoglobin will be giving the bright red appearance mainly, which is the normal appearance of our blood. Now, when we talk about the skin, it is further divided into the three main layers: the epidermis, the dermis, and the hypodermis, which is also called as the subcutaneous fat. Now, when we talk about the epidermis, it will be mainly the superficial or the superficial of the most of the layer, and this will be mainly involved in the protection, as well as it is involved in the vitamin D synthesis, and also involved in protecting and creating the impermeable barrier mainly. It will be further divided into the five layers, which you will be guys seeing in the histology. Let me go to the next layer, which is the dermis, which is the, unlike epidermis, this is the vascular layer, which is sensitive to the stretch as well as the pain as well. Now, the dermis will be closely related to the epidermis at the specific points to produce the flexor or the Langer lines mainly. Now, these lines are present, you guys can see on the neck, and these are important ones because it will be present longitudinally in the limbs, whereas horizontally present in the trunk or the neck. Now, this importance of this structure is that whenever we move the or place the incision along this line, there will be minimal scarring, while when we move or produce an incision perpendicular or at an acute or obtuse angle to this line, the scarring will be too much and we need to use lots of suturing there. Now, one thing we need to remember, these flexural lines are produced where the skin, which is the epidermis, is tightly applied to the dermis mainly. Now, when we talk about the surface irregularities of the skin, on the other aspects, we have the tension lines and we have the flexural lines. The flexural lines are commonly seen on the joints regions, whereas the tension lines are usually the polygonal or the lozenge shaped lines, and this will be present on the different parts of our body as well. The flexural lines are normally present or associated with the joints. Here you guys can see this is our are associated with the palm. The palm flexural lines allows the movement of the structures easily without the compression of the skin and the neurovascular structures. Now, when we talk about the appendages of the skin, we need to remember the important terms here. The nails. The nail will be mainly divided into these further part. Let me show you a diagram. Here you guys can see this will be our nail bed, where the nail will be mainly resting. Then we have the free border, which will be the growing part of the nail. Then we have the cuticle, which will be mainly covering the nail. Then we have the nail root, which will be the point for the nail to be embedded in the phalanx, and we also have the main part, the fingernail as well. The whitish part or the opaque part we see in the nail is called as the lunule. Now, when we talk about the lateral border of the nail body, it is usually an overlapped by the fold of the skin, which you guys can see it right here. This we call it as the nail wall mainly. Now, the skin, which is specifically the two zone, the stratum germinatum and the corium beneath the root, produces the nail bed only, which we have discussed. This will be mainly the area which will be providing the nutrition to the most of the nail. Then we have the rest of the nail bed, which will be containing sterile matrix, along which the nail bed there will be allowing a smooth medium for the nail to slide and glide and grow. Lunule will be another very important structure of the nail, which will be mainly the avascular structures, and therefore they will be allowing for their pink color mainly. Okay, guys, this was all about the normal one. Let us goes to the clinical anatomy, which is the most important for the dermatological point of view. Now, when we talk about the anemias, which is the lack of the hemoglobin or RBC, the nails usually appear pale or white mainly. And whenever we have also the condition which is called as the clubbing, when there is the chronic supportative disease like the lung abscesses, or there could be osteomyelitis or severe cyanosis may be present mainly. We will be discussing the major part mainly. Next, we will be discussing the important sweat glands mainly. Now, for the clinical point of view, the sweat glands are very important. They are divided into the ecrine and apocrine. The ecrine are those which are more abundant and they are produced in most of the part of the body, and these will be producing the secretion without the cytoplasm mainly. They are somewhat merocrine in nature, means they produce thin watery secretion without the disintegration of the cells mainly. Whereas the apocrine, which will be mainly present on the specific location, the axilla, eyelids, nipple, areolas, and the groin and the external genitalia, this will be involved in mainly providing the oily secretion instead of the normal watery like secretion, and this will be involved in giving the specific typical odor as well. Unlike in humans, it is very much important in the animals which are involved in for the mating behaviors or for the time when the fertility is much more expected. The secretion of these glands will be kind of increased. Now, when we talk about another important gland, that is the sebaceous gland. The sebaceous glands will be mainly involved or associated with the hair follicle. Let me show you guys. Now, here you guys can see this is our sebaceous glands, which is associated with the hair follicle, which will be mainly pouring their secretion into the hair follicle all the way to reach the surface of the skin. Then we have the sweat gland, which will be not associated with the hair follicle, unlike the sebaceous gland. The sebaceous gland produces the sebum, which will be mainly oily like material, which is also having some bactericidal action and also involved in protection as well as the regulation as well. Now, further divided in terms of the layer just under the skin, we need to go through the fascias. Now, the superficial fascia is going to be the layer of the connective tissue which will be present just beneath the skin, and this is mainly involved in the various functions. Number one, it will be mainly fatty in its composition. In most of the areas like the breast, thighs, buttocks, there will be the major containing the fat regions mainly. Then we have the deep fascia, which will be present deeper to the superficial fascia, and they will be mainly involved in producing the compartmentalization or mainly involved in attachment or giving the attachment to the muscles mainly. And also they will be involved in producing some important structure which you guys can see on the palmar aspect, the ulnar bursa, the flexor retinaculum, the palmar reticulum. We will be discussing them in the locomotor module as well. Now, moreover, it is involved in producing the interosseous membrane, which is mainly a fibrous membrane connecting the two bones. This could be the radius and ulna, and also for the leg, there is the tibia and the fibulas mainly. Okay, guys, this was all about the one shot lecture. I hope everyone have enjoyed it till here. If you guys have any suggestion, let me drop it down, so let me improve it. Till then, as always, keep studying hard, stay motivated. Allah Hafiz.